Osteonecrosis of the jaw, ONJ, is a serious condition characterized by the death of jawbone tissue due to a lack of adequate blood supply. It is most commonly associated with the use of certain medications, dental procedures, or underlying medical conditions. Here's a detailed overview. Definition and pathophysiology. Osteonecrosis refers to the death of bone tissue caused by disrupted blood flow. In the jaw, this leads to exposed bone that fails to heal within 8 weeks after identification. The jawbone is particularly susceptible due to its high turnover rate, dense vascular supply, and frequent exposure to trauma or infection from dental and oral activities. Causes and risk factors. 1. Medication-related MRONJ. Bisphosphonates, commonly used for osteoporosis, metastatic bone disease, and Paget's disease. Rankle inhibitors, e.g. denosumab, used in osteoporosis and cancer therapy. Anti-angiogenic drugs interfere with blood vessel formation, used in cancer treatment. 2. Trauma or dental procedures. Tooth extractions, dental implants, or poorly fitting dentures can initiate ONJ. 3. Other risk factors. Radiation therapy. Radiation-induced osteonecrosis is associated with high doses of radiation to the jaw. Infections. Chronic infections or periodontal disease can contribute to bone necrosis. Systemic conditions. Diabetes, cancer, and other diseases that impair blood supply or healing. Clinical presentation, symptoms, exposed bone in the oral cavity, pain or discomfort in the affected area, swelling, redness, or pus discharge indicating secondary infection, difficulty eating, speaking, or chewing, loosening of teeth without obvious cause, stages, per the American Association of Oral and Maxillofacial Surgeons, at risk, no symptoms but on medications known to cause ONJ. Stage 0, no clinical evidence of necrotic bone but nonspecific symptoms, e.g. pain. Stage 1, exposed necrotic bone without infection. Stage 2, exposed necrotic bone with signs of infection. Stage 3, extensive necrosis involving adjacent structures like sinuses or fractures. Diagnosis. 1. History and clinical examination. Detailed history of medication use, radiation exposure, and recent dental procedures. Visual inspection of the oral cavity for exposed bone. 2. Imaging. X-rays, CT scans, or MRI may show bone destruction or infection. Biopsy. Rule out malignancies like osteosarcoma or metastasis. Management and treatment. 1. Conservative management, oral hygiene, regular cleaning to reduce bacterial load, pain management, analgesics and anti-inflammatory drugs, antibiotics for secondary infection. 2. Surgical treatment, debridement or removal of necrotic bone, major resection in severe cases. 3. Adjunctive therapies. Hyperbaric oxygen therapy, HBO, promotes healing by increasing oxygen supply. Growth factors or bone-stimulating agents improve bone regeneration. 4. Preventive measures. Dental evaluation before starting bisphosphonates or rankle inhibitors. Avoid invasive dental procedures during therapy. Maintain excellent oral hygiene. Prognosis. Prognosis depends on the stage of ONJ, promptness of treatment, and the patient's overall health. Early diagnosis and conservative management can lead to better outcomes, while advanced stages may require more aggressive interventions. Conclusion. Osteonecrosis of the jaw is a challenging condition that requires a multidisciplinary approach for prevention, diagnosis, and management. Collaboration between dentists, oral surgeons, and healthcare providers is crucial, especially for at-risk patients.